First, we need to understand what morbid obesity is. And on this site, there's a morbid obesity calculator. You enter your height and your weight, and it'll give you a number. Just like your diabetes may have a number, your cholesterol has a number, obesity has a number as well too. If your body mass index, the BMI, is 40 or greater, you are a candidate for surgery. If your body mass index is 35 or greater and you have medical conditions like diabetes, high blood pressure, high cholesterol, reflux, sleep apnea, you are a candidate for obesity surgery, whichever one you choose. Right then and there, you have an answer. You are a candidate for surgery if you have these conditions or these setups. Now, for folks who are interested in having their insurance company cover this, your obesity and the medical conditions that go along with it, as well as all the things that you have tried to lose weight, must be carefully documented in your doctor's office notes. That's really important if you're going to pursue this through insurance companies. And as you've heard us say here on the website, obesity is a major medical problem. It causes major problems and it puts your life at risk. And we don't want that. You don't want that. And I want to help you to make sure that all of this goes away for you. As you know, morbid obesity makes your life more expensive. You feel socially isolated. There are folks who have experienced discrimination at work, during education, even in their health care. I've even had patients tell me that a doctor that they've been going to for years, when they bring up the topic of trying to lose weight and take care of obesity, their doctor goes absolutely crazy and treats them horribly. And I don't understand that. If you have a real medical condition and a real medical problem, why should anyone make you feel ashamed or guilty? Well, I am here to tell you that that madness stops today. Nobody does that to you ever again. Because starting today, once you decide to have surgery, you're going to cure this problem, and all of that goes away. Because all you've done is come to a doctor and ask for help. And I will give you that help. I will give you the surgery you need to make you healthy and lose all those medical conditions. The National Institutes of Health stated that weight loss surgery was the only treatment that produced sustained and meaningful weight loss. That's a great answer. That's a great answer for you because that's exactly what you want to hear. Surgery does work. It can help you lose weight and it will make you a healthier person. And the important thing to answer is, why are you here? You're here to find out about surgery. But importantly, you're here because diets haven't worked for you. And the truth of the matter is that we have celebrities on television trying to sell you grass and cardboard diets, which are impossible to stay on. And even the celebrities have regained their weight after being on those fad diets. And that's why it doesn't work. These diets are not meant to be lived in a normal human life. They put you on these strange products. You can only buy those products through them. That's not normal life. And so people quit. And at the most, these folks talk about losing 10, 20, or 30 pounds. And once they're off that strange diet program, they regain the weight. Let's talk about prescriptions. There are prescription medications out there, but they are risky and they have side effects. They can have intestinal side effects. And there's one medicine that they wanted to bring to the United States that increased the risk of suicide. So imagine that. The risk of a medication was the potential of you killing yourself. That's not life. That's not living. And the other thing we know is that the older you become, the harder it is to lose weight. That's why surgery makes such good sense, because it's none of those things. It's something that works and it can cure the medical conditions that go along with the severe obesity. So as I stated before, our government, in the form of the National Institutes of Health in 1991, told us that weight loss surgery is the only treatment that produces sustained and meaningful weight loss. It's the only treatment that impacts medical conditions that are associated or made worse by obesity. That is really important because now a major important institution dedicated to science and healthcare in the United States has told you that obesity surgery works. That's the main treatment for obesity. That's why you're here. Diets alone are not effective long term, and we won't talk about diets anymore on this site. We'll talk about nutrition and good nutrition. Pills don't work, and now you've heard me say that surgery will cure and improve the medical conditions associated with obesity. Surgery is safe, and it works. A lot of people will tell you that surgery is too drastic, that it's too risky, that you should be able to do something else. Well, isn't the medical conditions of diabetes, high blood pressure, high cholesterol, and sleep apnea, aren't those risky? Aren't those drastic? Aren't they affecting your life? Aren't they taking your life away? So why not do something that is going to effectively and safely treat those conditions once and for all? We know for a fact that folks who have obesity surgery live longer and healthier lives than folks who don't. The science about surgery for obesity is very well documented. Back in 1995, that's where we had the first evidence that surgery was a cure for diabetes when it was associated with obesity. After that, we found out that obesity surgery reduces the cost of health care, not only for your employer, but for you as well too, because you're taking less medications, you're having less doctor's office visits and less tests. And in 2007, we figured out that it is a cure for not only for diabetes, but that high blood pressure will go away, sleep apnea goes away, even heartburn and reflux goes away. So those are very powerful reasons, and that's very powerful science that tells us that obesity surgery works, and it is a cure, and it improves your health and your life.